Hello, everybody. This is Leila, Health Education Manager here at AiArthritis, and I am excited to report back on day 2 of EULAR 2025. And this debrief video is going to be all about Sjögren's disease and all of the updates that they gave us here at both the abstract sessions as well as the What's New in Sjögren's session. And so I'm going to go through a few different categories of updates, and the first one is having to do with B cells, mRNA, and new molecular insights. Researchers are now exploring interferon pathways that drive Sjögren's disease. So they're having new studies that are using mRNA technology that was inspired by the COVID-19 vaccine. And they're uncovering how immune cells become overactive in salivary glands. So that's basically why we get dry mouth, is because the immune cells are becoming overactive and attacking the salivary gland. So that's exactly how dry mouth happens in Sjögren's disease. And so they're basically trying to use similar technology that they used to come up with the mRNA vaccines for COVID, to be able to study this in Sjögren's disease. And this also includes single cell analysis, to kind of check and see where the activation happens. And this is hopefully going to lead to better targeted therapies when it comes to Sjögren's disease, because right now there aren't really any therapies that are able to stop and help the dry mouth, the dry eyes, a lot of the different symptoms that come with Sjögren's. And the next topic is biomarkers. And so a lot of people know that when you are being tested for Sjogren's, that you get tested for the SSA and SSB antibodies. Specifically, there's proteins that are associated with those antibodies that are called Rho52 and Rho60. And that's RHO 52 and 60. And these are antibodies, and they are not interchangeable. A lot of people think that they can be interchangeable, but they actually carry different risks in the disease. So if you are Rho 52 positive, then that means that you are likely to have higher inflammation, more increased systemic symptoms, and possible increase of risk of lymphoma. Because for those of you who don't know, lymphoma is actually a common comorbidity of Sjogren's disease, and that's something to look out for. So if you're Rho 52 positive, that means that you may be at a higher risk for developing lymphoma with your Sjogren's disease. And Rho 60, these patients, if they're only testing positive for Rho 60, that means that patients tend to have less severe disease. But if you are double positive for both Rho 52 and Rho 60, that shows the highest level of systemic activity and potential complications like lymphoma, like neurological manifestations, all of the different things that can happen with Sjogren's disease. Next topic is subgroups, or what they're calling clusters. And so they've decided to classify patients in these clusters, which are cluster 1 is high systemic activity and at greater risk of lymphoma. Cluster 2 is moderate activity, and this is more common in children, as well as cluster 3, which is lower disease activity, but of course not without risks. So it's basically talking about severity of disease and personalizing treatment plans depending on how severe and what cluster you fall in. And that's really a big theme here at EULAR this year overall, is personalized treatment, not having, just the standard of care being automatic, but making sure that there's also the personalized part that's put into it as well. Each patient is different in how the disease manifests for them. And so although guidelines are very helpful on where to start, the way that a patient's treatment plan should be tailored has to do with their own individual manifestations of their disease, their symptoms, and their preferences on medication and things like that as well. Another thing that has been recognized here about Sjogren's disease is that autonomic dysfunction is under-recognized. And autonomic dysfunction really just has to do with your autonomic nervous system and it malfunctioning because of Sjogren's disease. So this can include a lot of different symptoms like brain fog, and other parts of your body dysfunctioning. And they're looking to use, sorry, like brain fog, fatigue, digestive issues, and even dizziness that may happen with Sjögren's disease. And they are testing out a tool called Compass 31 that is helping to kind of put a quantity to these symptoms. And these symptoms don't always show up in traditional lab tests, but they are the most affecting the quality of life, quality of everyday life for patients. Specifically, we hear so much about fatigue and brain fog. And so they wanted to be able to try to come up with a tool to be able to see how these patients are changing over time and why they are still experiencing these symptoms even when inflammation is controlled. And so that's a really big thing that we talk about. We Another big topic here is remission. And even though you can be in remission where all of your numbers are doing very good, you know, your CRP is down, your ANA is down, all of your inflammatory markers can be down, you can still be experiencing these autonomic dysfunction symptoms. And again, they really affect everyday life. And so using this compass tool to be able to measure the activity and see why these symptoms are still happening, even when inflammation is under control. The next thing has to do with improving diagnosis when it comes to Sjogren's. We all know that sometimes you don't have the blood markers that may indicate a disease, but you do have symptoms. So they're coming up with other ways to be able to see the changes that Sjogren's may be bringing to a patient's body and maybe not necessarily their blood work. And so salivary gland ultrasounds are becoming um, a thing to be able to diagnose Sjogren's, and they are able to improve early detection and accuracy by doing simple training on how to look at the ultrasound of the salivary gland to see how affected it may be. And that can also be a very good indication of Sjogren's disease and help expediting diagnosis. On top of learning how to read the ultrasound of the salivary gland, there's also AI tools or artificial intelligence tools that are being developed to help interpret complex biopsy results. So, taking the biopsy and putting it under the microscope and kind of doing the very minute details of trying to find what you're looking for Sjogren's disease can be expedited with feeding the data into an artificial intelligence system and having it be able to sift through the biopsy to find what is important to be able to give that result and test for the disease. And this is really, really important. Again, like I mentioned before, for seronegative patients. And I know that earlier this week, when I was talking a little bit about Sjogren's, we had one of our members ask about seronegative Sjogren's. And so I will make sure that I send you this video so that you can get more information about how to better analyze your Sjogren's, even if you're seronegative. So if you're testing negative for the antibodies that are normally present for Sjogren's disease, these biopsies and also the salivary gland ultrasounds can really help. And last but not least, wanted to talk about treatment response and stratification. But basically, some trials now use biopsy inflammation levels to predict early treatment response. And so taking the biopsy is super important to be able to try and figure out which mechanism of treatment is most likely to work for a patient. And this is called personalized medicine or precision medicine, basically looking at the different interleukins, the different antibodies, and looking at those to be able to use that to interpret which treatments you may respond best to. And so early evidence shows patients with high levels of interleukin 17 or interleukin 6 may respond better to certain therapies. And there's, again, this theme of a new goal to identify patients who will respond best before even starting the treatment. And this saves time from step therapy, having to go through the different channels of the different treatments, or as well as just even trial and error of trying to find what works for each individual patient. There was a lot on Sjögren's disease this year because it's become a really hot topic. A lot of the different pharma partners that we work with all have interest in creating molecules or treatments for Sjögren's disease. And it is so exciting to be able to see this on the horizon. I myself live with lupus and Sjögren's disease, and my lupus is very well under control, but I do feel like my Sjögren's is more contributing to the everyday symptoms that I feel every day. And so just being able to see all of the treatments that are on the horizon for Sjögren's disease is really exciting because I do know in the Sjögren's community, it's really tough that we don't have any FDA approved treatments. And so hopefully in the next year or so, we'll start to see some of these come out of phase 3 clinical trials and start to see Sjögren's patients living better quality lives with these new treatments. And thank you again for coming with us. And this is Go With Us Day 2. We still have 2 more days of amazing debriefs from all of our team and excited to see you then. Alrighty, talk to you soon. Bye.